Speaker recognizes Representative Schor.
Oh, thank you, Mr. Speaker. I rise to oppose this omnibus budget bill today. I'm disappointed to have to do this, but in my opinion, this bill is not reflective of the priorities that we as a state should be pursuing. We need here to create a state that will attract young talent to remain here. To do this, one thing we need to do is create great places. Yet, we're not supporting our communities. Even though Budget Director Nixon last week announced that the Great Recession is over and we are again reinvesting in our priorities, this budget gives no increase whatsoever to communities after they've been cut by $5 billion over the last 12 years. We also need to create a healthy Michigan. Currently, children in 75 of Michigan's 83 counties receive assistance through the Healthy Kids Dental Program. This is a tremendous program piloted by Delta Dental and the Department of Community Health to improve the dental health of those greatest in need. The governor proposed to expand this program to Ingham, Ottawa, and Washtenaw counties. My constituents appreciate the recognition of the need here in the city of Lansing. Yet, the governor's recommendation was eliminated in this budget, and an amendment to restore this yesterday was defeated. Finally, I'm going to address an issue that colleagues have addressed. This budget has removed the governor's recommendation to accept millions of dollars that would assist 500,000 people to have health care, and that would also save taxpayers millions of dollars in uncompensated hospital care. The issue of Medicaid expansion funding has come up to me in a variety of places recently, coffee meetings, constituent meetings, neighborhood meetings, and others. I tell my constituents that accepting the expanded Medicaid dollars would help between 400,000 and 600,000 Michigan residents, and many of them here in my city, in the city of Lansing. These are people that have no health insurance now and must go to the emergency room when things get really bad. I tell them it will reduce uncompensated care, that people would be able to receive preventative treatment and not be forced to use emergency rooms. I tell them this will save millions for taxpayers in future Medicaid expenses, including about $200 million in the first year, according to House Fiscal. Additionally, House Fiscal estimates that new federal revenue to the state would range from $1.9 billion to $2.2 billion per year over a 10-year period. For a total of over $20.5 billion. I tell them that the amount saved in uncompensated care is estimated to be $300 million, which is much more than the percentage that Michigan will have to pay starting 3 years after the program, after this year, in order to ensure that these 500,000 residents have health care. I then tell my constituents that the governor actually came up with a plan to save money and pay for this when Michigan has to contribute in a few years. I then tell them that we're looking at this bill today and that the House and Senate have both rejected these federal dollars, which will ironically make us even more of a donor state while keeping these 500,000 people without health care and actually costing taxpayers more in the long run. This, of course, coming after our friends in the other chamber rejected $34 million for a health care exchange, which then cost us $8 million for a total loss of $42 million. They ask me, why is this happening? So I tell them what I know. I tell them one claim is that there's fraud in the Medicaid system. They then have said to me, isn't there potential for fraud in any government program? Isn't there the possibility of fraud in farm subsidies or the dredging program we just passed for $24 million, or cash given directly to developers from the government with no accountability for jobs? So I tell them, okay, that's a good point. My colleagues have said that there is not enough capacity. Well, my constituents have reminded me that this isn't true because according to the hospitals and clinics, they say they have the capacity to take care of these folks. I tell them that, that there is a concern about big government programs. And my constituents in these meetings have actually reminded me that Medicaid and several other big government programs have been in existence now since the 1960s and have been funded regardless of whether Democrats or Republicans have been in control. Then why, they ask, are we rejecting this? The only argument I have left is that there's opposition on philosophical grounds. But I have told my constituents that I'm looking forward to the debate today so I can come back and tell them why the majority in this chamber is deciding to reject this funding, which will help 500,000 of our residents and save our taxpayers millions of dollars. So I'm looking forward to the answer. Thank you, Mr. Speaker.
Thank you, Representative.